First guest is my partner of more than 30 years, Dr. Keith Applegate at Family Practice Associates. Welcome.
Thank you, Jeff.
All right, now I said mosquito bites, tick bites. You know, we had a mild winter, so we're seeing a lot of pollens and allergies, but we're also seeing a lot of bugs, and we're hearing a lot in the press about tick bites. Is it something to worry about?
Well, certainly we always get concerned about a tick bite, but patients oftentimes come to us with tick bites. Basically, the rule of thumb is if a tick has been implanted and embedded for 36 hours or more, that's when we really become concerned as a medical community. Prior to 36 hours, the chances of the tick transmitting any type of illness is very, very low.
Now, you talk about illnesses. What kind of different types of illnesses do ticks transmit, and what are the symptoms we should worry about?
Well, one of the ones that we hear about the most is the Lyme disease. We also hear about Rocky Mountain spotted fever. Ehrlichiosis is another one. Oftentimes, the thing that we will see with a tick bite is the characteristic rash. For instance, with Lyme disease, there is a bullseye rash in which the site where the tick was embedded becomes red, but over a period of time, could be up to 3 weeks later, there is a circular ring that forms around the area of the tick bite. That would be pathognomonic for Lyme disease.
So if you get one of these symptoms, you ought to see your doctor, obviously, but do you need to see the doctor just because you're bitten by a tick?
Not just because you're bitten by a tick, but if you do have this characteristic rash that I'm speaking of, or you present with headache, fever, general body aches and pains, yeah, we get worried about that. But the problem is that fever, headache, general body aches and pains can go with many different types of illnesses. But when it's coupled with a tick bite, we get a little bit more concerned about that.
And it's really rare in Kentucky to see Lyme disease.
It's very rare. There have been a few cases over the past years that have been identified. We worry about our patients who have traveled, particularly to the Northeast, to New England, where it's very prevalent.
Okay. Now, other insects, mosquitoes, we've heard a lot about that in diseases.
Well, the one we've heard about with mosquitoes is the Zika virus. We heard about that quite a bit last summer. Fortunately for us here in central Kentucky, the chances of coming up with the Zika virus is very low. However, our patients who have traveled to Africa, South America, Central America, but now the alert is also to Miami, Florida, and Brownsville, Texas. So if you've traveled there and you come down with the headache, red eyes, body aches and pains, fever, those we become worried about the possibility of a Zika infection.
So if you want to prevent mosquito bites, is there things you can do in terms of keeping them from biting you?
Well, absolutely. First off, wear long sleeve shirts, long pants. Try to avoid being out at dusk after hours when the sun is going down. We sit on a screened-in porch. We also use insect sprays. DEET, an insect spray that contains DEET, is very effective for preventing mosquito infections. Also, we can spray our clothing with a pyrethrum spray, only on the clothing, not on the human skin, and that does a wonderful job of repelling mosquitoes.
So we can control bugs, we can treat illnesses if they get it in the environment, but also there's the sun.
Absolutely. We always worry about the sun as physicians because so many times we'll see our patients will present that they think they've only been out in the sun for a very short period of time, but yet they come to us with first-degree and second-degree burns. And what defines a second-degree burn is when we have a blister. So what we try to do is tell our patients is to limit the exposure to the sun. Try to avoid being out in the sun between 11 a.m. and 2 p.m. Wear an effective sunscreen with an SPF factor of 35 or higher. But always remember, when you apply the sunscreen, it's only going to last for about 2 hours. You need to reapply frequently.
It's great information to help us stay healthy this summer.